If you or someone you know are prone to getting shaving bumps or just bumps on the back of the head that look like acne or scars, this is a condition called Acne Keloidalis Nuchae. And I want to show you a real patient encounter where I diagnosed this and proposed some treatment for this patient. This was done in my mobile clinic where we go out and we see patients who don't have health insurance or who otherwise wouldn't be able to access a dermatologist. This patient was kind enough to agree to filming, and we're grateful that they're helping us to educate more people on this condition and understand what some of the treatments might be. Come with me as we go into the exam room and see how this condition looks and is diagnosed. Robert?
Yep.
Good to meet you. We're dealing with a condition on your scalp, and you've been, how long has that been going on?
Oh, it's been going on for about 5 years.
Okay. Itching all over, more concentrated on the back.
And at the top, it started off on the top here, but on the back there, it's been prominent for the longest time.
Okay.
Started off one day, and then it's just constant. Times it gets flared up, and other times it actually diminishes.
So let's take a look at the scalp and then kind of see what's going on there. So on the back, you do have, little bumps that kind of look like acne right along the bottom of the hairline. This is a condition called Acne Keloidalis Nuchae, and it's really common, and it's due to little ingrown hairs. When those hairs get cut short, they come through the skin, but not through the hair follicle. That leads to a lot of inflammation in the scalp, and you can get scarring almost that starts to happen, and those bumps have a really hard time going away. A couple things that will help that condition is to not cut your hair too short. So getting those buzzers and going real short usually will exacerbate the condition. The longer you can let your hair grow, adopt a kind of a longer hairstyle, that tends to help. I'm going to give you a shampoo to use across the scalp that I think will help with itching. It does decrease the yeast that live on our skin, and everybody has a little bit of yeast that lives on us. And you really only need to use it about 3 times a week, about every other day. Rub it into the scalp, scrub the back, let it sit for 5 minutes before you rinse it out. And then I'm going to give you a little topical steroid ointment that you can put on there to help with the inflammation. So you'll apply that on there just as needed. If the bumps are not bad, if the itching is not bad, I don't want you to use it because we do try to limit the use of steroids when possible. But if you're having a flare-up of it, or something stressful is coming up and you want to try to prevent it, go ahead and use it. And then we always like you to take a break after using it for a week or 2 if you need to.
Okay.
If this isn't enough to help, there is another medication called clindamycin lotion that can more specifically help to target the bacteria that live on the scalp. And we kind of have to see if it's more of a fungal thing for you, more of a bacterial thing, or more just inflammation. But I think this initial regimen is going to lead to a lot of improvement for you.
All right.
So there's refills on this, and then at any point, if you have questions on the treatment plan, you can always call our office. Even though we're just here in the mobile clinic today, you can call our main office, and we're happy to answer questions and refill prescriptions as needed. Guys, thank you for watching the video. I hope you found it instructional and educational. And again, thank you to the patient who allowed us to use their images. Now, if this is a condition that you suffer with, as you heard in the video, generally you shouldn't try to cut your hair really short, and certainly don't be shaving with a razor in this area. When you can let the hair grow a little longer, you're less likely to experience ingrown hairs, and that is ultimately what's leading to this intense inflammation, that response that leads to scarring that will be permanent. Now, if you have this kind of scarring, sometimes we will see improvement with steroid injections directly into some of the scars to flatten them, to make them a little bit softer. If they're very large, sometimes we do surgically excise them. The topical clindamycin lotion and sometimes topical steroids will help to take away some of the bacteria that cause acne or the inflammation that leads to the intense scarring. In cases where we're not making any other progress with the traditional treatments, some patients might be a candidate for Accutane because that helps with a lot of follicular disorders. But that has its own risk of side effects, but it certainly can have some significant benefits, so it's worth a conversation with your dermatologist if that's something that you're struggling with, despite going through many of the normal treatments. If you'd like to see more patient encounters in the mobile clinic, you can help to support that work by purchasing your skincare down in the video description. We do get a little bit of revenue from that, and I use all of that to help fund the mobile clinic. We put gas in it, we pay the insurance, we buy some of the medications, and we go to these patients taking time off my regular clinic where I could bill insurances, and I want to do this for free. This is a dream of mine since I was a medical student, and we're grateful to be able to make it happen, and your support is critical to that. So you can purchase your skincare through us or other products mentioned down in the video description, or you can even be a supporter of this channel by becoming a premium subscriber. Thank you guys for watching. I look forward to seeing you on more of these kinds of videos, and anything else you'd like to know, just leave your questions and comments right down there in the comment section, and I'll see you guys on the next video.